Welcome to the Mayo Clinic Cardiovascular Continuing Medical Education Podcast. Join us each week to discuss the most pressing topics in cardiology and gain valuable insights that can be directly applied to your practice.
Hello, I'm Dr. Steve Kopecky, a preventive cardiologist at Mayo Clinic in Rochester, Minnesota. My pleasure to be speaking today with the chair of preventive cardiology in Rochester, Dr. Francisco Lopez-Jimenez. Welcome, Francisco.
Thank you, Steve. Pleasure being here.
Now, Francisco, you've been helping to head up our artificial intelligence tools in preventive cardiology. And you've come up with this concept of vascular age. Can you explain that to us? And how is that different from chronologic age?
Sure. So we know that people age at different speeds, and this has been observed for many years. That some people just don't age as fast as others, or the opposite. That some people actually age fairly quickly. So you see a person that is 60 and actually looks like 80, or the other way around. So we know that aging happens at different speeds. What we call as vascular age is what we believe determines the aging of our vascular system, including the heart, arteries, veins, and that might predispose people to develop heart attacks or peripheral vascular disease, or even developing strokes. So this is something that has been discussed at least for 3 decades, but we believe that we are getting into the secrets of how to uncover or how to describe and measure vascular age better.
And what tools are you using here at Mayo to kind of look at vascular age?
Yeah, what we are doing right now is we can calculate vascular age using the electrocardiogram, but to understand that, let me give you a little bit of a background in how vascular age has been trying to be calculated in the past. So about 20 years ago, some investigators noticed that people who smoke actually have arteries that look older, and also people who have diabetes or people with high cholesterol. So at the beginning, the first efforts to determine vascular age were based essentially on counting the number of risk factors. And according to the number of risk factors and how bad those risk factors were, it will be a way to sort of estimate the age of the arteries. However, the problem is that doesn't necessarily add much to what we know. We know that people who have risk factors have arteries that are more likely to be in trouble. So what we did here at Mayo a year ago actually was we noticed that we can actually predict the age using the electrocardiogram, but we noticed that the prediction was not perfect. So it was close, but in some people was not that close. In some people will be like a 10 or 15 years different than the actual age. So we asked ourselves, so is this just error trying to measure calculating age using the electrocardiogram, or is that error telling us something? So what we did then was we group people who where the electrocardiogram will tell us that they were much older than their chronological age. And also we group people where the electrocardiogram will tell us that they were much younger than the chronological age. And what we saw was that those who are older by ECG actually die earlier. And those who seem to be younger by the electrocardiogram actually live longer compared to their peers of the same age. So to us, that was an unequivocal signal that the electrocardiogram can actually tell us the vascular age. And then subsequent studies actually show the same for heart attacks and other cardiovascular events.
So a patient comes to you, you do the electrocardiogram, and they have an older vascular age than a chronologic age. What do you tell them to do? What can a patient do to reverse that or change that?
Well, I think the good news is that it seems like what we recommend for people to prevent heart attacks are exactly the same things that might get people to be younger And we have seen, more than few anecdotal situations where we ask the patient to exercise regularly and to lose weight and to follow a healthier diet. And 6 months later, the electrocardiogram shows that they are 5 years younger. So it seems that what we have been recommending all along actually makes our arteries become younger.
So in just 6 months, you can see a difference in the ECG age.
Absolutely, yeah, absolutely. So some people, in some patients, you might actually wonder if the graph is wrong because it seems to be going in the wrong direction. The patient is actually becoming younger and younger as time goes. But what happens is that they are implementing significant changes that are just helping the arteries to heal and to essentially become younger.
Fascinating. So what other tools may be helpful with artificial intelligence to prevent, look at age, vascular age?
Sure. Well, as you know, artificial intelligence has been evolving very fast over the last several years in medicine in particular. And we at Mayo have been doing a lot of experiments and studies trying to find better ways to diagnose conditions. And actually, our focus has been on using the electrocardiogram, a tool that has been used for more than 100 years, but trying to see if the electrocardiogram can identify other conditions that was not intended to identify. For example, we were able to demonstrate that the electrocardiogram can find people with a low ejection fraction, or when the heart is just not pumping good enough. And even when the electrocardiogram seems completely normal, in some situations, the artificial intelligence is telling us that particular patient surely has a failing heart. So that was one. And the other one that to me was fascinating was to tell us when a patient has atrial fibrillation, or one of those abnormal rhythms that can lead to strokes, even though the electrocardiogram seems normal. So to identify those individuals might actually be a game changer in the future, because if we can prove that those individuals are more likely to have strokes, even though the heart rhythm seems to be normal now, but the computer is telling us that this person at some point during the day or during the month is actually having atrial fibrillation leading to stroke, we might be able to treat patients way in advance and to know who might be at risk for strokes.
So you can find atherosclerosis with an ECG. You can find hypertrophy with ECG, so hypertension. You can look at things like heart failure. What about some of the infiltrative diseases, amyloid, sarcoid? Do you know anything? Can you?
Yeah, absolutely. Yeah, we're actually just finishing a project right now that it seems like we can identify those with cardiac amyloidosis. And again, what is fascinating is to see cases where the electrocardiogram will seem completely normal otherwise, but the computer is telling us that this patient has a very high probability to have cardiac amyloidosis. And we actually have several cases that the electrocardiogram was already showing that signal years before the patient was diagnosed with cardiac amyloidosis. So that's another situation that might help us to identify patients where the cardiac condition was not even suspected, but the electrocardiogram might be telling us that years in advance, years before the official diagnosis is made.
That's really fascinating. What a great tool, and relatively inexpensive and certainly low risk test like electrocardiogram. Congratulations on all that. Any other parting words for us about artificial intelligence? Where do we go from here?
Well, I anticipate that there will be a lot of developments in the next few years, and certainly artificial intelligence will not replace doctors. I think it's going to just make our lives easier, and it's going to make patients to be better off, to live longer, and will make medicine more advanced and more accurate.
Great. Well, it's a wonderful message. Thank you, Francisco, for joining us today.
Thank you, Steve. Thank you for the invitation.
Thank you for joining us today. Feel free to share your thoughts and suggestions about the podcast by emailing cvselfstudy@mayo.edu. Be sure to subscribe to the Mayo Clinic Cardiovascular CME podcast on your favorite platform and tune in each week to explore today's most pressing cardiology topics with your colleagues at Mayo Clinic.